Thank you for tuning in to Global Elite Academy. If you're interested in opening a non medical home health agency, please go to globaleliteacademy.net. We have a class that you could take online, and then we'll help you get the policy and procedure manual. And that is the whole course plus the policy procedure manual is $2,500. Or you can get a one-on-one where we'll help you do everything from start to finish. You'll have a class that lasts for a few months, and we'll help you with the license. We help you get your IHSS license. We just help you with everything. And that is $15,500. So please go again to globaleliteacademy.net. Today we're going to talk about Florida. Opening a non-medical home health agency in Florida. Now in Florida, let me tell you that it is regulated. In Florida, you can get, so they have two programs there. One of them is you could get licensed. Well, the first one you don't have to have license, but you can get a home care agency, non-medical. But you can't, it's for homemakers. You cannot give hands-on care at all. So in other words, it's like a companion company. You don't have to be licensed for that in Florida, but it's companion care. So you can hire caregivers, you can send them in the home for companions, but they cannot do any hands-on. In other words, if the patient was in the tub and wanted her back bathed, the caregiver would not be able to bath her back, because she's not able to touch the patient at all. Now you can open up that in Florida without having a license. But if you want to have a license, then you have to open the non-medical home care agency, and that you can give them hands-on care. So then if the patient wanted her back bathed, if you had a license in Florida, the caregiver would be able to bath the patient's back. Do you understand that? So one way, you don't have to have, it's non-regulated. You do not have to have a license if you just want to give care to people without giving on hands care. The other way, you have to get licensed if you want to give them hands care. So basically it's companion, because for a companion is not allowed to give, to touch the patient. So that's why I use the bath. If the patient got out of the tub and wanted his back rubbed, for companion help, you cannot rub the patient's back. So if you had an agency in Florida, the one that that's not licensed, your caregivers could not rub the patient's back. But if you went on and got your license, which means hands-on, then the caregiver could wash the patient's back. Okay? So one is with the license and one is without. You should always get with the license, because people are not going to want to be paying all that money for home care, and then you can't give them any hands-on or anything. They're not going to like that, because people complain about that. So if you just had companions, that's it, and let's say you wanted to start to see how it was going to be before you get your license, you could do that. Just go ahead and open up an agency and get a few patients just for companion patients, And if you like it, then you could go on and get your license to get hands-on care. They do have IHSS in Florida, and that is what it's called down there too, in-home care support services. IHSS. So they do have that. So you also can apply for that in Florida with your non-medical agency. And so you would do the same thing. You would just, so if you just wanted to, I had a guy that called me from Florida. His agency had been open for a few months. I think he told me 3 months. And he now wanted to get it licensed, but he had opened up the companion services, homemaker services, they call it. He told me for the 3 months, he had only been in it 3 months, and he was making $18,000 a month. That's very good. You know, he had just opened it, and he only had companion cases. So what he was calling me for now, he wanted to get his license in Florida so he could expand his service and take patients now that wanted hands-on care. So he probably, if he's making $18,000 a month for companion services, when he gets ready to expand that, he's going to make more money than that, because you could charge more for regular service than you can for companion. So he just wanted to get his feet wet in it. He liked it. Like I said, he'd only been open 3 months, and he was making $18,000 a month. So now he wanted to get, hands-on service. That's really good. So now if you just want to open up the companion service, you just register your business. That's it. Just register your business. Get your business name. What structure, LLC, corporation, or individual, sole proprietor. You have to set that up. Open up. Get your business name. And then you're ready to go for that part. But if you want to if you do that just to see how it's going, then you can go back and just apply for the license to get the hands-on care. And then when you apply for the license for the hands-on care, you can also apply for IHSS, or you can apply for a Medicaid, Medicare patients. You know what I mean? You could just add everything a little at a time. You don't have to go in when you first opening up your agency and just get everything at the same time. You can add a little bit on at a time. Even when you're in another city, like Colorado, I always tell people to start off with your regular non-medical agency and your IHSS agency, and then patients, and then when you get that open and running, and that's been open for a few months, then you can get your license for Medicaid, Medicare patients and get those. Because you'll be and got your feet wet and know how to run it, run your business. You won't feel so overwhelmed. So there's not anything special you do in Florida, but I do think that's good that you can open a companion service first without going through the licensing and all that, just to get your feet wet and see if you like it. And then you can go on and expand and, get the license later on. I think that's a good idea. Unless you get your feet wet, see, like I said, if you're going to like it or not. So, that's in Florida. Now, when you open up, I've had people ask me For the IHSS, how do they get their patients? Well, you're going to get your patients either once you sign up, you'll go on that website, the state's website. So people, when they're looking for service, they can either go to the website and see, who all have the service, or you'll probably your name is going to go to the social worker, to a social worker. So the social worker will email you referrals for patients. For my company, my consultant company, what we do is I work with a guy who's able to get you on the number one page for Google for your SEO. He's able to get you on the number one page. It takes about 2.5 to 3 months, and then people will start calling you. I have a lady that's in Arizona. He's working with her agency to get her on the number one page of Google. I think she told me she was number 7 or 8, and she's already getting calls. And when they call, they tell her that they have IHSS and they're looking for caregivers for, their loved ones. So that's going to bring in it's going to bring in private pay, but you will also get some IHSS patients. And some of them, I've had people tell me, some of them, Medicare patients, period, they get Medicaid, Medicare patients, even though you get them through the social worker. When you start marketing, which, like I said, when he gets you, if you're working with my company, and he gets you up on the very first page of Google, you're going to get all type of calls. So you'll get calls for Medicare, Medicaid patients. You'll get called for IHSS patients. And you'll also get called for private pay patients. And I don't know if I explained to you all that when you're doing the IHSS patients, you could do them for elderly patients. You could take them in for children or for disabled. It's up to you as to how, what type of patients you want to take them in. Most of the people that I deal with, because they have a non-medical home health agency for seniors, they're dealing with IHSS senior patients for that. They might have some that maybe not senior, but most of them are. But you don't have to. If you want to open up an agency and you just deal with children, then it would be, you would apply for the children, 18 and under or 17 and under for the children if you want to. Or you maybe just want to take disabled. But if you decide that you want to do children, make sure, you're going to be able to have the caregivers to take care of that. Because there's a shortage out here for caregivers looking to work with seniors. There is a shortage. And there's even more of a shortage if they're just going to be strictly working with disabled patients. And then it's going to be more of a shortage if they're simply working with children. Because a lot of the caregivers, don't like to work with children. So you're going to still experience that where, it's just a shortage out here. So you could decide. When I'm talking about it, like on the show, I'm talking about IHSS for seniors, but you can remember that if you don't want it for seniors, you don't have to have it for seniors. You can just decide you want to take in disabled or children. But whatever you're taking in, I look at it like this. The non-medical, that's for your private pay, long-term insurance. And then IHSS is for people who can't afford to pay for it, but they may need long hours. But it's lower class income people. And so that's why I tell people to when you're going to get your license for your home, for your non-medical agency, just get the license at the same time for IHSS. Okay, so that's about it. That's what they have in Florida. If you have any questions, you can please go to my website, globaleliteacademy.com. Look up my phone number and give me a call. Thank you so much. Have a good week.